going to the game? Is anybody going to the game? Absolutely. Yeah, really. I don't think. What's going on, man? All right, good, dude. Good, 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 good. Good evening. Yeah, I don't yeah, yeah. My goodness, it's gonna be cold out there. I have nothing to do with it. Yeah, yeah. From my chair, my couch. Best place to see it. Oh, really? That's unheard of. No, I don't. But it's unheard of. Now's would be the chance to get it if you got $60 tickets, I guess. But I don't have nothing to do with it. You man, you going out there? You going to the game?
No, I got offered to go to one game this year, but I couldn't make it. I feel bad every time I miss a chance to see Mahomes play, though. Chris, what's your last name? Remind me. Harkins. I'm so sorry. Thank you. All right, shall we get started? Okay. All right, I believe it's about 7 p.m. on Thursday, January 11th. So we'll go ahead and do a call to order to start the meeting for the North Kansas City Equity and Inclusion Committee. We'll go ahead and do an attendance for everybody. So Ryan Brooks. Oh, and do I have that on? Yes. Okay, good. Ryan Brooks.
Present.
Jennifer Boyd.
Here.
Bess Bailey. Doesn't look like she's here. Daniel Trotter is here. Martin Newton.
Here.
And Krista Harkins.
Here.
And Amy Clark is here, but not a voting member. So, anyhow, all right. Any guests? It looks like we have a sparse audience this evening. So I don't think we'll have any comments from the public. Does anyone move to approve the meeting minutes from last month's meeting?
I move to approve.
And a second.
All right. All in favor say aye.
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 That will be an approval of the minutes. Thanks for those of you who made it to the work session. I was ill last week, so I couldn't make it, but the questions looked really good, I thought. Does anyone have any feedback on those, or do we want to talk about kind of what we're hoping to get from those questions or what the process was? Just for, I guess,
Just tell you that I am hoping tonight for a motion to
Okay.
submit those questions to be included on the survey questions that will ultimately be looked at by City Council. But I would look for a motion on that this evening.
Sure.
I'll make the motion to approve those.
Does anyone second that?
I'll second it.
Ryan seconds? Yeah, let's go ahead and vote then. Motion to approve the community survey questions. All in favor say aye.
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 We'll go ahead and approve those. So I think they look good. And Mallory, you can put them on the
Yes,
survey.
I will put them on. And I also apologize for not being there. I was ill as well, so
I was sick too.
Really? Oh my gosh.
yeah, it
Holy cow.
was a bad day.
Quick question, Mallory.
Yeah.
With that, the questions then go to the firm, then come back to us.
Correct.
So they will still review them.
They'll still review them.
may-
Yeah.
They may look a little bit different, but
They
we're
might.
all
These
trusting.
questions that we put, because these will be included at the end of the survey, they usually leave them pretty, because we've made them. So I don't imagine like substantive changes. So
Right.
The next item on here is a discussion of branding / logo. Does the person who added that want to?
That would be me.
Okay, cool.
I put that on there because we were talking about things like being more visible in the community, and especially with Snake Saturday Parade coming up and the Pride Parade over the summer that we participate in. We don't have anything that really shows who we are. We have the North Kansas City United shirts, but everybody thinks we are the United Methodist Church. And we also have given so many of those out to the public. How are they supposed to identify us as committee members that they can come up and talk to us and voice their concerns on? If I saw someone out there, I would think, oh, well, they're just somebody like, like me, just another citizen. So that's kind of what I was thinking of. Do we need to have something that specifically shows the Equity and Inclusion Committee, like something directly for us as committee members and as a committee to show who we are and identify us a little bit more separately from the community members and United Methodist? I'm sure they do great things, but
So you're looking for like apparel that the committee members would wear specifically, and not so much to change the.
right, I think.
Which I don't even know how you guys got to this logo,
Yeah, don't
but
either.
okay, okay. Yeah, I mean, we can start. We can absolutely order whatever you guys would want.
I have a couple of suggestions to piggyback on it. I completely agree with what she said. Because when we are out at certain places, it's very difficult to know who we are and what we stand for, those type of things. A couple of suggestions would be maybe like what's it called, like buttons, something kind of big that's just to show who we are and a little bit. We could even have that same logo on it, but just North Kansas City EIC,
Yeah.
Something like that.
Yeah.
And also hats. We don't have hats when we are out. Like sometimes it's a little bit inclement weather, something like that. Hoodies, long sleeve T-shirts, with the logo on the back and maybe on the front, something like that. That shows who we are or something. It needs to say though, North Kansas City Equity and Inclusion Committee,
Okay.
and then maybe someone suggested last week, EIC.com or something like that. Someone was talking about maybe try incorporating that into something that we have.
Okay.
Because that way, when somebody have questions, they automatically know where to get in contact with us from. No
Okay.
no brainer, no questions. No brainer.
Okay.
Just a couple of ideas. Yes, something like that.
Okay,
like that.
so how about for the February meeting, we bring some apparel ideas, and then you guys can take a look at them, and maybe we can vote on some items that you think would be good, and we can get those ordered. And then we can check into the EIC.com. That would be us.
We were at nkc.org/EIC.
I think it exists.
Well, we could put it on.
Oh,
Yeah.
on more things.
Yeah.
Yes. Okay. I think it's on the magnets, but I don't think it's on anything else. Yeah. Okay.
Do we already have a banner? Oh, sorry. Do we already have a banner or anything, a small table-sized banner? Because I know, like, when we were at the multicultural event, even if we just had a banner across the front of the table, I think it would have been really easy for people to tell why we were there. And ask
Okay,
more
like with the
questions after.
contact information and
Yeah,
everything
just
like that? Okay.
Just to, like, put across there.
Yeah.
I think
Okay. Yeah.
I want to say
Okay.
we invest in a feather flag with the kind of current branding with the All Are Welcome, NKC United.
Okay, because I
believe
think
we have that in
Yeah.
somewhere.
you have that, but it doesn't have any like contact information on it. I don't
Right.
think. Yeah.
Yeah, and I think before we were mainly focused on the NKC United as kind of being an all-encompassing brand, but I understand where you're coming from, just with that not necessarily being helpful
Yeah.
or specific enough.
Okay. Well, we'll come.
February?
We'll come to the February meeting with some options, and then we can take a vote on them and get those items ordered.
Okay. All right, and then so the next item is the YMCA contract, and you had included that as a link, and I believe we have the hard copy in front of us as well.
Yeah, so I included it
Hard
as a
copy.
link. I also printed each of you a hard copy, and this is just sort of an optional. So we are currently in negotiations with the YMCA on a new contract. So I've included the original contract. There have been some minor amendments to it throughout the years, but nothing too substantial. So I just included the base original contract. And so if you'd like to take a look at that and mark that up either electronically or by paper, and then give that to me, or if you just have some things that you think you'd like to be included in that, or something that maybe we're leaving out, you can just shoot me an email with those. It doesn't have to be super formal or anything like that. And then I can pass that information along to our city administrator, who is the one who is negotiating the contract, and then we'll ultimately present the contract to council for review. And so maybe if you're going to do that by the February meeting.
Anything specific you want us to look for? I mean, is it mainly like language and just inclusive?
Yeah, I think it's
Inclusive
language. I think
language.
we would look to you, and I'm sure Amy can speak to this too, but to sort of look at it through the community lens and what would be equitable and inclusive for our community and members of our community, as far as what memberships would look like, because we do own the building that they operate in. Making sure that it's accessible to all members of our community. I think is that where you were going with that?
Yeah, I think, it's just, I want your guys' eyes on it too. We're looking at different financial aspects of it. There used to be something written up where it was like any expense over $5,000 has to be covered by the city, and that becomes, it starts to become astronomical, because it's kind of like, what? And sometimes we're noticing then there's no motivation to really fix something until it hits the $5,000 mark. And then it's like, oh, we need you guys, because we didn't bother to fix this, or whatever it might be. That sort of thing we're sifting through. But the other piece is, they've obviously, we voted in to implement, and I believe keep, I know for this year, but I don't know continuing, keeping the special rate for North Kansas City residents. It's a lowered rate for family, lowered rate for individual. And just kind of looking at that, there's obviously still free, in this existing contract, there's still free childcare. When you come in, you can drop kids off, go work out, things like that. Are any of you guys members of the YMCA by chance? Okay. Yeah. And so I'm also, we're looking for feedback to kind of say, we need kind of eyes in there to kind of scope out some of the improvements you'd like to see, or things that kind of stand out to you that maybe haven't been addressed. People have pointed out like pool stuff. There's leaky everything. Like the windows are breathing in air in the pool area and things like that, which are not very efficient. But I think just getting an eye and a lens on, again, from an equitable perspective, in any insight or any input that you guys can see that maybe we might be missing. We have some time. I don't think this is one where you have to review it and it's absolutely due, because I think we have to have like kind of final markups by what date?
Well, we've given the notice that we will not renew
Right.
the current contract, and that was last month that we gave notice, and we had 12 months from then, so we basically have 11, but we never want to wait till that final
Yeah, I was thinking
hour.
by like
So,
July, if we
yeah.
have like things sorted through. So it's not like a hurry up homework assignment, but just kind of trained eyes, like as you're using the facility, and just kind of, just anything you see that as we re-explore, because I'm sure we're going to stay largely close to what the contract reflects, but then we're also trying to look at it to say, this is the time, because I think the contract's for like 10 years at a time.
Yeah, it'll be however long we want to
Yeah.
make
Well, this
it
previous
for.
one, I
But
think was
yes.
what, a 10-year
Yes,
contract?
it was a 10-year contract.
You know what I
Yep.
mean? So I'm sure there's some updates that could occur after a 10-year period of time that we can look at, we can appreciate, and also point out the things that you guys would like to see kept in there. Or, I know they do a good food drive. They just had one, I think, a week or two ago. Stuff like that. Just kind of wanting your guys' eyes on it, just for any input you might have to offer. That's it.
I have a couple initial questions. I don't know if this is the right time, but number one, so you said this was a 10-year agreement that we were just kind of coming,
Yep.
that we just decided not to renew?
Yeah, so in 2014 is when we originally entered into the agreement, and prior to that, we operated. We owned it, operated it. It was the community center. Yeah.
And you say that, so I was curious about, I feel like maybe 3 years ago, North Kansas City got special rates. Was that just added on like as an addendum?
Yeah. So originally,
North
when
Kansas
we
City
negotiated the
citizen
contract with the YMCA, there was nothing in there for North Kansas City residents to get special rates. And then I think it was about 3 years ago, maybe just 2 years ago. Okay. Yeah, it was post COVID. Yeah. Council. So it's actually not. It is a special rate, but the city subsidizes it on
Sure.
the back end. So that's how that works.
And then, yeah, I I've always been curious. They changed their hours during COVID, and I don't think the hours have ever changed back, which I know is tough. They had really difficult staffing issues, from what I understood. It's a little difficult. Used to close at 9 p.m. Now I think it closes at 8. And I want to say it used to open at 5, and now it opens at 6 probably. That could be. I believe there's 2 hours on each end, or 1 hour on each end. That was not added back. Yeah. One thing that has always rubbed me the wrong way about the Y, they would typically close down the basketball court like 20 minutes before shutting down. Like, there's an announcement like, if you're on the basketball court, we're closing in 30 minutes. The basketball court closes in 5 minutes, if that makes sense. So, like, you had to be off the court. And I just felt like it was a little bit of a backhanded, like, everyone who's playing basketball, get out of here because we don't want to have to. You're going to keep playing, until we're closed. So I felt like that was a little bit unfair and just maybe singled out the people who want to use that court time for as long as, the place is open. So,
Yeah, see, that's exactly something that we would be looking for. So something that we could include in the contract, that like all amenities must stay open,
Especially for those new shiny floors.
Yeah.
They
Yeah,
just
I wanna see 'em.
replaced,
basketball
so-
court we just paid for.
that's
better be
cool. I
using
think
that
it's a great
basketball
place,
court.
though. I mean, it's incredibly diverse. There's really good representation of people who go there, and I think they have a lot of really, like, the culture of the Y is consistent. Yeah, the equipment is nice. It's a great facility. So North Kansas City's lucky to have it. I feel like the Y is a good group to run it, but yeah, I'll let you all decide that from an operations perspective. All right, so item 8 is about the hospital and community support and transportation conversation that we've been having.
Yeah, so I just threw this back on. Amy didn't ask me to, but I just figured maybe we could continue the conversation. And my homework item was to follow up on a program that I mentioned, which was a pilot program between the City of Gladstone and North Kansas City Hospital for hospital transportation. And I'll be honest, I've been unsuccessful in knowing how that program turned out, but to my knowledge, they're no longer doing it. I don't know why, and I haven't heard back from anyone at the hospital. So I don't know, but I don't think they're not doing it anymore. So I don't know if it wasn't successful or if they found an alternative.
Ryan, do you know anything about that program?
I don't know anything about that program. I know they have different, every hospital I've ever worked in, including North Kansas City Hospital, has different funds and resources they use especially for transporting patients when they don't necessarily have rides places. They usually try and figure out something because obviously they want them to follow up. Like I mentioned last week, I do kind of wonder if one of their big difficulties is that a lot of their primary care offices are no longer on campus because the Meritas Health Clinics are spread out so much through the Northland now. I think they've moved a lot of primary care offices off campus, and they have a lot of specialties on campus, but they now have doctors everywhere and like therapy and stuff everywhere too. So I do wonder if maybe it was just too much to cover.
Yeah, and I do know that they will, like if a patient is released and they don't have transportation, there's funding for that. And so they do provide that patient with transportation. But I think we were looking at it more from a like routine doctor's appointment visits, like how are people getting to and from the hospital. But you're right, it's so spread out that I don't know if that's a lot of our people that are going to see doctors in the Meritus system aren't going to North Kansas City Hospital. They're going outside of our city, and so I don't know.
Well, and Ryan, you may know this too. I mean, this is kind of a side bit too, but just kind of on that equity issue or what we can do for North Kansas City residents, knowing that we have a hospital. I was curious if there's like, wellness exams that are given at maybe a lower rate for those without insurance, just those sort of preventative things, or just how are you doing? Let's get an idea of what you may need in the future, just to check in, because I think a lot of people are resistant. They think if I don't have insurance, then I am not allowed to go do anything. I'll just, wait it out. And I think the more we can kind of promote, come in, let's work through, let's see how we can help you. And then maybe just the piece, of I thought I had heard, I want to say from Valerie Pearman actually, that they did like you could do like some sort of cardiology exam for like a discounted thing. Like if you got, almost like an event, like the flu shot event, but do it like now you can go get this test and it can be done on site and lower for everybody or lower for residents or something.
I don't know if they still do, but I think for a while they were doing an event at the Y where they would do like health
Yeah,
and wellness.
I think they
checkups.
still do because
Okay.
we up until just a couple days ago, our wellness program was through North Kansas State Hospital. We've parted ways with them, but we used to do, and you could go over to the Y, and it's certain days of the week, and I believe there is a program that it's like almost either free or almost free, and they'll do the finger stick, blood and blood pressure, A1C, everything,
Yeah.
the whole, and then and it was at the Y, and I knew it's successful, so I think they're still doing
I
it.
think so because I thought it was like they would do like quick like blood pressure check
Yes.
and like then just like do some diabetes education and things like that with the community. And I don't know how often they do that. The Y would probably know, I assume, because I'm sure they schedule it. But
Yes, I think it's actually on their website somewhere. Yeah,
Comes to the
Yeah.
Y. Is that what's happening?
yeah, it's
Okay.
it's nurses. Yeah,
that's what I
Okay.
understand.
Like a
Yeah.
nurse practitioner? Or
yeah,
nurse-
because it's
yeah.
the same people that do our or did our biometrics for our wellness screening. And we offered our employees the opportunity to, if they couldn't make it to our scheduled biometrics, to go to the YMCA and get it done. But anyone can go there. It's not, you don't, it's, and I think all the information is on the website.
Okay.
I do know too that, and then maybe this is something we could look at doing. I know that yesterday, North Kansas State Hospital was supposed to be at, or either yesterday or the day before, was supposed to be at the Liberty Community Center doing free, I think it was like free biometrics. They had to cancel because of the weather, but so maybe that's an opportunity for us to partner like with Parks and Rec and see if we could use their facilities to offer something like that for no, you don't need insurance, you don't need to show anything to get it done.
Yeah.
So
No, I think the Equity and Inclusion Committee could be a part of that. I mean, that's a huge equity thing to say, hey, no matter what you got going on, your background, anything, just come in. This is a first step in just having a shot of like where you're at
Yeah.
and kind of what some maybe advice and direction beyond that. I don't know what we do beyond that, where it's like you give them the results, you're like, good luck out there. But it's just to give them kind of a spot check and just have the opportunity, because I'm sure there's plenty of people that just haven't gone in years because they just feel like it's not accessible to them.
Well, I don't think they do that mobily. I've never heard of that mobily, but you can pay, and it's like a nominal fee. It's like $35. They'll check your arteries. I'm not a medical person. For blockage, yeah, and it's not insurance. You just pay for it.
Yeah, I was going to say that. I feel
it's
like
like
Valerie
$35.
Pearman went to
Yeah,
something.
I'm sure she did because a whole bunch of our employees have done it, and then they'll do another one, which I believe is a heart, something with the heart, and it's like $65. It's on North Kansas City's website, but no
Okay.
insurance isn't even submitted. You just literally pay for it. Now there are age guidelines for it, so like
Sure.
I couldn't qualify. I couldn't get it. I couldn't just walk in there. You have
Right.
to be over a certain age, but
Unless your test pointed you in that direction.
correct, unless it's ordered by a doctor.
Yep.
But I do know that North Kansas State Hospital offers that because several of our employees have done that.
Okay.
We,
Go ahead.
at Jackson County, they bring in like a mobile unit. It's like a van, like where you would give blood and stuff like that. They bring in a mobile unit that does the biometrics and does like the artery scans and all that. So I don't know who's providing that, if it's, but I wonder if North Kansas City has something along those lines.
Like I said, if you're saying that they do have that, you're saying at the hospital. That wouldn't be
It's at
something
the
they offered
hospital, yeah.
through YMCA.
Yeah,
You go to the
I'm not aware that they have a mobile unit.
I feel like I've seen a mobile unit out in the back side, like sort of the back entrance for the ED, like where the paramedics drop off. There was like in that little circle.
Well, I was just there.
No, not like
I
in
took
this
an
last
ambulance
week.
there last week on
No.
the day we were supposed to meet,
Yeah.
and I did not see it.
No, yeah, I don't think it's been there like now, but I've
Okay.
walked past her and said, "You're like, no, I legit was there. I'm sorry to admit, no." I've seen something like that, like cardiology, but again, it could be something totally different. They could be making
Yeah, well, we can reach out to them,
Valentine's in
and
there.
we'll reach out and see. what-
Awesome.
I know on their website too, they have like a community, they have
Yeah.
a calendar of community events because they do quite a few different like health-based events. And then
Like
they
the
even-
mammograms and
Yeah.
all that,
mhm,
yeah.
Yeah.
If you go there though during the like special, they'll give you all kinds of free stuff, and yeah, it's like a party.
I wonder, would it be helpful if we could see if maybe they have like a representative who could come talk to us for one of our meetings, like to see if there's anybody who'd be
Yeah.
willing to just discuss like what are some of the programs they already offer. I mean, I know that stuff is probably relatively available and we could probably look some of it up, but it might be beneficial to talk to someone and also
Yeah.
like see if they have any other ideas too.
I think that increases like our offerings too. If we're trying to connect with the community more and more and more, and I think any time we're engaging with the community, if we even have something that says like also health check, also this is available, just something so it's like just know that you have these opportunities that you may not have seen in the flyer in the mail or gone online to look at or known to look at it. I just think if we can increase that, I don't know, we just end up in a better position. And we have just more to offer, to discuss with them to say, hey, we can help you navigate the city and what your benefits are of living here or whatever it may be.
So coming full circle on that, basically we would want to talk to the North Kansas City Hospital about the complimentary services that are available like at certain parts of the city. Is that what like we're trying to hammer down and then hopefully present as some sort of like as an amenity of the city?
Yeah,
Will?
we're looking at options, like just seeing what's completely off the table, not realistic, what is a possibility, and I think just starting the discussions to kind of see, hey, is everything off the table? Is there even one service that's still just solely available or primarily focused at the hospital where we could take, folks from the gardens that have appointments or whatever it may be? Are they located right there so it's very accessible for them, or what does that look like? I think we're just trying to grasp and understand kind of what any and all options could be, I guess, And I'm interested. I mean, in a dream world, I'm like, man, it'd be so cool if there's somehow where people could have, not that they would have priority, but that North Kansas City residents, that there's some sort of, advantage for us that we're here in the city and that there's some sort of kind of presentation to say, here's what we are doing for North Kansas City residents that we want you to be aware of, that's so specific to us that live here. Whether that be people that don't have insurance that maybe have an opportunity to go there at a lower rate or whatever that might look like. I don't know what the potential partnership, and I realize that could just become like real slippery and opened up. But I would like to explore because I don't want it to just be something that we do leave off the table that, people that could have gotten care could have kept even working or could have gone in the direction they wanted to go. And what stopped them is they just simply didn't know that they had access. I don't know.
And yeah. That's what we're here for. And then from like a general transportation standpoint, has there been additional discussion at the council meetings about that?
Well, we did vote to extend. We did have the package as a 6 to 6, fixed and flex. Flex is back, so flex is flexing, and we've already gotten great feedback. Like somebody's like, "Oh my gosh, I have a ride to work now. I don't have to pay an Uber," which is really fantastic when you have to spend, part of your night's salary to get there and back. That's not advantageous for anybody. So, and there's someone working in our community, and so the flex is good, and we've got it extended now all the way till the 11 or 12, whatever the regular sort of cutoff time was for those bus schedules, instead of 6 p.m. because we didn't want to cut out the handful of people or more that still need to get to work or still need to get to where they have to go. It's really hard to put a dollar value on even one person that needs to get somewhere that doesn't have an option. So yeah, that's squared away for now. But again, it's from the costs that we're still asking for the formulas that they're using, or just kind of how are you coming up with these numbers? And we've yet to get that from them. They're just kind of like, just trust us, because it's just not sustainable, cost wise. It's not going to be sustainable for the city to maintain. So we're just trying to get creative as best as we can to kind of go, how do we tackle this? Because I think I don't know anyone that I run into that's like, no, I'm against the buses. I don't know anybody that's against public transportation. I think we all can agree it plays a very important role in any city, because it's not just our residents that have to get around; it's people coming in that work here that sometimes have a 2.5-hour commute to come work in our city. So I don't want to wreck somebody's livelihood for public transportation. So it's just something to think on. And I know city staff is looking at things too. And obviously we had an RFP that went out, and then we came back to the drawing board of like, and we're back with KCATA. But I mean, that's where we're at right now. And I think public transportation is going to be more important than ever in the coming 5 to 10 years when gas prices really start to climb, and and inflation of car prices, like all these things, not to be scare tactics, but it's kind of like we're maybe going to see that people are going to start opting for alternative transportation altogether. Not just buses, but more bikes, more just different forms of transportation that aren't just reliant on even electric or gas or whatever it may be. So just kind of throwing it out there so it's on your radar as just something to kind of think on, that, as we're looking at going forward, like what could that be? Is there like an initiative to put on the ballot? Is there, if we reach that point, there's all sorts of things that we may have to explore. And I think I just kind of looking for your guys' input too. Yeah. But for now,
Is it totally unrealistic to have a bus service that North Kansas City operates? I'm just wondering.
I don't think it's totally unrealistic. Back in the 90s, we used to operate somewhat of a taxi style service. I think it was the 90s, might have been late 80s. It's difficult, extremely difficult, especially for a city of our size. But it's not impossible. It's just that it would probably end up costing just as much, if not more. And then we open ourselves up to a lot more liability
Yeah, for sure.
than before. So it's just something to think about. It would also be hard for us to capture federal funds, harder for us to capture federal funds, just because we'd be such a smaller agency rather than an area transportation authority. So that and those federal funds are what reduce the cost of our KCATA contract enough to make it even feasible. So it's not impossible. And I think if it were the will of the council, of course, we'd do it. But at this point, I just don't think that's been the preferred route.
no, and they saw that we had a committee that looked at the numbers, and I honestly wished an EIC member would have been on that committee as well. But because that would have been, just another set of eyes. But and I think they made the right choice. I think we're somewhere around 700,000. It's about there for the total contract, which seems like, oh, okay, not that bad. But we have a transportation budget of just over $500,000, and that 700,000 is with a 30%. I think is all we got instead of 33, whatever it was, anywhere between 30 and 33% federal. Sort of grant money that's dispersed amongst the outlier communities from Kansas City. So from my understanding, from my memory, is that they apply for these grants, and then those get sort of divided amongst the participants. And then, with us waiting and kind of weighing things out, the percentage dropped a bit, but it's still, I think we're still a little bit less than what the original
So basically we
contract
have
was.
no subsidy, we'll call it, for our additional hours, which make us operate the same as every other place in the Transportation Authority's network. We have no federal funding going towards those hours that were just added back on, and that's why the cost of that was
189
higher
for like 3
than-
hours.
Yeah. But the problem really is that we can't get numbers, so we don't even know how much it's costing for one person to ride the bus. I mean, we can't get those numbers from ATA. So it's hard, but at this point, I think that the committee and the council as a whole decided that that was the best route to serve our community, and so. But we're gonna have to start talking about the contract again here real soon.
Yes,
So.
very soon. I mean, definitely by July we're,
The extension just gives you enough time to take a couple nights sleep. and
Yeah.
recover.
Yeah.
Well, and luckily this isn't just an extension. This is a full-blown contract. We were doing extension and a little bit more and a little bit this, and then there was a thought that we're like trying to look at it in all these different ways, and there's an understanding maybe there's a 30-day notice, so then we have time to kind of do this or that. Well, it was really 7-day notice, and that's not enough. To tell someone like, you thought you had a ride to work, but now you don't. Good luck out there. We just couldn't. I don't think any of us on the council felt good about. I certainly didn't feel good about, knowing that even 1 to 5 to any people were going to be left without a ride when they assumed there was going to be transportation there. So, yeah, right now we're making it work, but I want like everybody to be aware that it is one of those things that we've got to like laser in on and figure out, because the transportation budget is what it is, and it's already not sustainable. It just already has not been sustainable. So
Right, we just transferred money, at the council approved to transfer money from a gaming, so casino revenue reserve fund to pay for the additional almost $200,000 that it would cost. And, that fund, that's what it's for. It's for emergency situations like that, but now that fund is diminished, so.
right, it's starting to become like a fund of like certainty. It's just like,
Yeah.
well, we for sure need to be funded by gaming. I mean, even our water bill was funded by gaming for a while, like subsidized, which is just wild to think about businesses' water bills being subsidized. That was very painful to realize. Residents, sure, in some way to like maybe catch up or reconform, but yeah, that's a whole nother topic. But we're trying to move away from such heavy reliance on gaming, and right now we are very reliant on gaming, and all these different funding mechanisms that go into all of our accounts. They're going to start to fall off as years go. There's like a tiered system, especially with TIF, and then the gaming. I think that starts to shift around 2030. I'm going to make up numbers. I don't want to.
Well,
make
it
up
just,
numbers.
the gaming industry is smaller than it used to be. It diminishes, so that's what makes our revenues go down there. And then it's a lease situation, so there's uncertainty on whether we'll continue to lease to Harrah's or not. So that's why that looks like that. But yeah, so if you want to lobby for anything, sports betting
Right.
in the state of Missouri.
So right now, the federal grant funds we're getting is actually dispersed to us from Kansas City.
No, so
That
we don't receive anything.
Well, but that's how they're
KCATA,
yeah.
yeah, but it's not through Kansas City. It's
Okay.
the Kansas City Area Transportation Authority receives the funding directly from the federal government through Surface Transportation Funds, and then they allocate that out evenly. Although we're really not sure how that breakdown is either. But I assume it's by size of community, population, whatever their number is, and then it's applied to that specific contract with that municipality. There's only a few of us that are enclave cities, and so and then that reduces your contract, but we never see those dollars. Actually, it's just a reduction.
It's just a reduction of our contract. Is there something that we as a city can apply for grant?
So if we ran a transportation network, absolutely, we would be eligible to apply. The problem is when all these other big transportation networks apply too, they're going to get the money before we're going to get the money.
So there's
And they're gonna
nothing.
get a larger pot of it.
So there's nothing that we can do on a separate to kind
Like
of
in addition
subsidize.
to.
Yeah.
No.
Okay.
No.
This is probably going to be so bad, but I'm going to take the risk. but it's kind of like, what if we look at the hospital to help subsidize, that extra cost that we don't have budgeted beyond the 500,000? I imagine 200,000 is much cheaper than trying to come up with a transportation opportunity and employees to pay and vacation and benefits and all the things to making a shuttle service happen. I don't know. But I know plenty of people get dropped off at the hospital, use the flex to get dropped off the hospital, stuff like that, and the fixed routes, employees too. So I don't know. I guess I'm just curious how we can try to make this work and getting ahead of it versus having to react like we did this time around.
All right. As always, thank you for the feedback on that, and that does kind of transition to any other updates that you have going from recently.
Well, we've got to focus pretty quick in February for what we're going to do for Snake Saturday. I would almost recommend that we have either a planned meeting before now and the next meeting, or at least a couple meetings in addition to the February meeting, so that we have kind of a game plan if we are going to look to participate. I don't know when the sign-up cutoff or time is for that.
I'll be honest, I don't know either.
Okay.
It's probably on their website.
Oh man. We've all learned about the Royals not coming here. We're all aware. All right. Very good. I'm just so excited to get my life back. Woo! That was fun. Okay. I'm just trying to think. We didn't have a ton of agenda items between when we've met. End of December to now. I'm going to fail you guys. I feel like everything is kind of coming up. Oh, there was the discussion, I guess it wasn't put on here, that we had kind of individually. So I brought it up. So we have this agreement right now where the city helps to fund Northland Assistance Center. They're a great organization. They help. What they've primarily done is help residents, if they need help with water bills, electric bills, utilities, rent, mortgage, whatever it might be. They might have hit a point of struggle and need some assistance. And so for really any North Kansas City resident, they offer that, whether it be food, whether it be literally helping to pay the bill, extending money to pay off the bill and things like that. And Rita runs that, does an awesome job. She then came as a result of the Scott Ike Center that was built, that whole organization when Scott Ike had passed away in freezing temperatures, Kansas City. You guys were probably part of the EIC, or some of you were here, maybe. I don't know. I guess none of you guys were, but there was a whole plan to do an emergency shelter plan. I'm not labeling it correctly, but they worked with Chief Hargis with the fire department and the police chief to say, Rita was like, I don't want people to die in our city because they're out in the cold. So she has a relationship with American Inn, and we help fund individuals to be able to stay there when it reaches freezing cold temperatures. We realized on this latest contract there was a bit of a miss where there weren't any thresholds in place. That, if she kind of went outside and felt like it was chilly, she would extend, rooms, usually at a week at a time, to individuals. And I had just asked, do we know? It's tough because this is based off a very specific incident, and I just thought, how are we handling this? I don't know if you guys are aware that the jail in Liberty is being renovated. So once that renovation started, they had to release a bunch of prisoners because they're like, we don't have room for you. We got to do some renovations. Good luck out there. And they were just literally set free in the streets to walk around and, live their lives because there was no room to keep them. What we face here is we don't have a 24-hour holding cell. I think it's like max 4 hours or something. I don't know the hours associated, but we don't have a place to keep anyone for any extended period of time, and therefore there's a restriction because they have nowhere to put somebody that has committed a crime in our city if because the jail's being renovated. So I had a concern that I thought, oh no, not that you don't have rights to live and things like that. And I'm sure you're maybe getting yourself in trouble because you're cold. I mean, there's probably so many reasons, right, that I'm not sitting down with these individuals to know. But what I worried about is that our city is potentially funding someone that just committed a crime against our city and is then being paid to go stay in a hotel on the city's dime in the hotel rooms. And so I guess I'm looking for, we as a council are going to start to, we want to make sure on the new contract for Northland Assistance Centers that we get back to the parameters of like, it needs to be freezing cold, like dangerous temperatures, because it is an emergency response versus just sort of like a, gee golly, I wish I didn't have to sleep outside. I mean, that stinks. Like, but it's also meant to call a shelter first. And if the shelters are full, then we are the remaining option, because the feedback we've heard so far is that it's gaining popularity, which, you know, word's getting out. We've heard the phrases, word's getting out, and we're gaining popularity, that people are coming here knowing like, hey, I don't have to go to a shelter. I can come and get a week at the American Inn. So I think we're just trying to work around those parameters. And there was an incident here after the council meeting in December where one of our council members had her window shattered on her car for no good reason. But the individual was taken in, released, because he shattered windows at the North Kansas City Hospital. Then he was taken in, and then he got back out, and he tried to shatter the windows at the mop bucket. Then he was taken in, and then he was released again, and then he shattered the windows to a car. And I just am like, the system's broken, obviously. And I think I'm just stuck with like what to do about that. Like, I don't know if anybody has any insight, I just feel like there's something missing in the middle. We obviously can't hold this person. I don't know who this person is. I've not met them, seen them. The police did know who it was. They're like, we know exactly who did this. I don't know if you guys have any input, or it's just kind of like one example, but it's just, yeah, if you guys have any insight on that, or any input on if you agree or disagree on there being, you know, reintroducing the weather parameters to the emergency plan, because she's already gone through, I mean, I'm sure with this week, she may be done with the budget. This week and next, I'm sure it's going to be pretty well depleted. And that's 30,000? Yeah.
That's what you originally approved. And then unless something changes, a new contract with additional parameters will be on the council agenda on Tuesday.
Okay. That'll be as soon as next Tuesday? Okay.
Yes, unless something changes. I believe it's ready to go, but we were giving it to her, so it could still change between now and Tuesday. But
Okay, so the new changes weren't in there. Well, then I would want
the
to
new
know.
changes are in there, but
Okay.
I believe we've sent it to Rita to look at.
Okay. So I would say, I mean, that's something we're voting on next Tuesday. If you guys have any input, anything that's, you know, not sitting well with you, or that you would like to add, or whatever it may be.
What were the temperatures like that we had in there before? Was it just below freezing, or did it involve like wind chill? Because
I think it was just temperatures, and I think it was below freezing.
It was wind chill. There
Oh,
was
it was
wind
wind chill,
chill in
okay.
there. There was wind chill. By the parameters we had on the previous contract, it was my understanding that when one of our council members evaluated the days that were given versus the days that should have been available, many more days were given than the days that met the original parameters. There was like 4 days that were in that emergency level, but there were, I mean, $13,000 worth of that was used up
You're talking about the contract we have like right now.
right now.
Yeah, there's no temperature in
Right,
there.
right. That's what
Yeah.
I'm saying.
Oh, okay.
I'm saying when we saw how the money just started to dry up, because we're like, we're not even in the cold temperatures yet. That piece, that very important piece, was left out of this current contract, and so it just became like, if I went for a walk in the morning, I felt like it was chilly or, you know, kind of cold, then I would make sure to get somebody rooms. You know, and obviously she can't. It's more advantageous. Like I love to see when we can help an entire family, If there's a whole family, there's kids. I'm like, absolutely, kids prioritize. It's trickier, and more expensive when we have many individuals because they have to be in totally separate rooms. It's not like a shelter situation where everybody's in one big room. So I don't know if there's any input that you guys have. I obviously want to see those temperature parameters added back in because it is meant to be emergency response. Yeah, and then anything else that's coming to mind for you guys.
Were the parameters removed for a reason, or were they just left off on the?
I don't write that contract, and I don't have anything to do with it other than I posted on the agenda. But I believe they were just inadvertently left off. Yeah.
I think, obviously, from my perspective, I would like to help everybody, But from a monetarily standpoint, I think there definitely needs to be some accountability. And if we have to do that because with temperatures, then I think that's probably a good idea. Whether it is, it could be 45 degrees and still be dangerous levels if the wind chill is down. So I would definitely want to see something like that included because we don't want people getting frostbite just because, because it is cold enough to get frostbite, but it's not below the actual temperature thresholds. But on the flip side, I would also think that there should be something for the heat. If temperatures are a certain level, heat index is a certain level, because that can also cause death.
We did fund that. Yep, there was, and that's a good point. We did fund that. She did have funding for the summer months when we did have those days where it was crawling above like 95, 100 degrees. Yeah, that was in place for sure. And she does great things. When she gets them in there, she's also helping them do laundry. She's giving them money, and our money doesn't go toward that. It's from the North Carolina Assistance Center. She gives them food. She gives them sometimes clothes, and laundry money to go wash things and get all washed up. But yeah, anything beyond, I guess I'm having a hard time because I don't think that somebody who gets arrested doesn't deserve to live, right? And gets housed. I think I'm just having a rough time of oh man, early intervention maybe would have helped because did someone damage someplace because they were cold and they were guaranteed if you can arrest me, I'm going to at least be warm tonight. Then that's definitely what we want to prevent. I can't make that assumption though. I didn't meet this individual, but I think I'm running that balance. What does it look like? Because I just said, it's going to be rough if because the jail is closed for renovations, we're then paying, and I don't know the cost difference. I forget because we have to pay the City of Liberty to use their.
Yeah, we pay the county actually because it's the county jail. But yes, we pay for inmates to be housed there.
Right. I don't know the cost. I can't remember.
It's off the top of my head, 13 or. It's not very much. It's dollars.
Okay. Per person kind of thing?
I think so. Or it's an annual contract, but it's still not a huge amount. They increased it for the first time in 20 years last year, but I don't remember what it was.
Yeah.
It's not exorbitant.
And I think in the original contract, there was also, and I don't know if it's included in this new one for Tuesday, a call to say you must have called shelters in the area first.
Yes,
and
I believe
exhausted
that
option.
is in the contract to be considered on Tuesday.
And then what sort of accountability do we have that step is being taken?
I'm not sure exactly what accountability we'd have other than we generally know when the shelters are full because our officers are meeting people on the streets just the same as the Northland Assistance Center is, and will take people to area shelters. None of them are local in North Kansas City, so that poses a problem. Our officers are then leaving our city to take these individuals, but we know the thing is, it's not like you just take them and drop them off. There's a whole intake process, so it's somewhat of a lengthy process, and so for our officers to remove themselves from the street when we already only have a limited number, it's a very time-consuming event. But that is always the first choice before the Northland Assistance Center, and so we know when the shelters are full. and when they're not. But as far as knowing if she called, or
Is there
not, I
kind of
don't
a
know.
general sort of site or alert or?
Yeah, I think it's online.
centralized-
I think most of them put it online, and then you can call at
Yeah.
any given time.
Well, I
and
just,
so-
I keep
yeah.
wondering if someone does call or if
like
it's
I'm
just like
assuming
an
dispatch.
assumption.
Well, see, most of the time we don't even know when the Northland Assistance Center is having an interaction with someone to get a room or a shelter. We a lot of time, 9 times out of 10, we don't. Our police department isn't involved in that we know of.
Right.
So I don't know what the.
What do we have as far as an accountability piece baked into the contract? To your point, Jennifer, and maybe you want to expound on what that could look like as far as accountability.
I don't know, but it sounds like maybe even, is there some kind of accountability for the funds that she spends, like some kind of report that we get? Because my
Yes.
accountant brain is
Yeah.
throwing up all kinds of flags right now.
In the past, it's been required as part of the contract that she report, or that the Northland Assistance Center report to the city on funding. It hasn't been, the follow through on that hasn't been great. So this has a much more robust accounting mechanism. So number of individuals in a room, how many nights they stayed, was it below whatever the parameter is for the wind chill each night that this person or people are staying, how many minors, like how many adults, how many minors. So there's a whole table included in this that will be considered on Tuesday, because that's been another piece of it. You want to give money to help serve our community, but there has to be some sort of, we have that for everything. We give people $500 grants for an event, and they have to turn in all of their receipts and everything like that, because it is public dollars.
Right, and that kind of data could help us decide, are we giving enough money, or are we giving too much money for this?
Yeah, I think another piece that can help too is we can understand when the shelters were full or not, and know what nights people were staying. So I think, yeah, that's a very important piece that in the past has maybe been not so strong. So
Another thing is there something in the new proposed contract that you just can't give out a week willy-nilly? Like this week, obviously, we're going to be below freezing for like the next 10 days.
yeah.
But if we only have a short cold spell or a short, heat wave, do they need to be in there for a week? Or
By golly, I wish I would have read this contract before I came here. I just saw parts of it. But yes, I believe, and don't sue me if I'm wrong. I believe that there is, yes, because we're trying to prevent that. While it may be cheaper nightly to put someone up in a room for an entire week, so $50 as opposed to $70 nightly, that's not the best way to use our funds. And so, yes, I believe there is. So you'll have to denote how many nights are below that, whatever the parameter is. And then, yeah, no one should be staying unless those temperatures are that. So, and that's tough. I know, because the whole thing is tough. Yeah. Yeah. It's just,
How are people identified as needing the funds to begin with? Are they usually reported by law enforcement? Like, I guess I just didn't know what the mechanism that we're finding people who need assistance
my
was.
understanding that right now, in speaking with law enforcement, 9 times out of 10, they're either going directly to the Northland Assistance Center or being referred to the Northland Assistance Center, possibly by one of our officers or maybe someone at the YMCA, anyone that in this area that would know that the Northland Assistance Center exists. But yeah, our police and fire do drive around, and like on a night like tonight, if there was an individual seen outside, they would certainly try and get them the shelter. I assume that we would house them in our police station if worse came to worse. You know what I mean? People can sit in the lobby, but we would never, and I can speak for both our police and fire departments, we would never let someone stay on our streets in this cold weather and die. We don't have any record, like going back as far as we can go back in the city, that has ever happened in our city. That's just not who we are. But they don't always refer them to Northland Assistance Center because their first point is always to call area shelters. Now, I'm sure the area shelters are full right now. I have no doubt that they are beyond capacity at this point. But yeah, so I think that most of the time they're just going directly to the Northland Assistance Center.
So my other question is there a mechanism where the community can get involved? Like I know originally I'm from Arkansas. Heat waves are nothing new to us.
Yeah.
But like the local churches or things like that would open up their doors or help at local areas to staff when we had a heat wave and we needed cooling centers. Is there something like that? Do we know if there are other community help, I guess?
I believe that the Y serves as a cooling center, but I believe it's just their personal mission. And I don't know that they stay open extended hours during that, which once it gets dark, it's usually, but as far as other community resources, I am not aware of any. I'm not aware of any churches that provide. They may, and I just don't know it. I'm not aware of any like warming centers though locally in North Kansas. I'm not aware that any churches have done that. Not that they couldn't. I think it'd be a
No,
great
that's an
community
interesting
initiative.
point.
Yeah.
Because, we have churches here and they have auditoriums. That could be a potential of just kind of like, what's the cost of turning on the heat in a big auditorium to kind of have a place, versus all the rooms.
Well, and even if they didn't have the facilities to house them for the night or two, they may be willing, or their congregation may be willing to help kind of take a collection up in as charitable work or something too. I don't know.
To this point, no one's offered that, but I certainly, I know that our police department would partner with them to refer people, just like how we do with the Northland Assistance Center. So the council agenda will come out tomorrow. Barring anything happening between now and then, this will be on that council agenda. So it's accessible through our website. If you haven't already, you can sign up for alerts and you'll receive an email when the council agenda is posted. And it's just a link. You click on it and you can see all of the attachments. And that should be one of them. And so I think, any feedback, send it your way because you're going to be the one voting on this. And you are always welcome to email every council member, whether you live in that ward or not. Always email every council member and the mayor your thoughts, opinions on any item that they love it. Like they welcome that, because it's hard to sit there and make a decision when you're not sure. I mean, I'm speaking on your behalf, but I'm sure it's hard. I watch you guys. I'm sure it's hard to sit there, make a decision that affects people's lives. And you think you're doing what's right for the community, but you're not sure because you maybe haven't heard from the community as much as you'd like.
It's kind of like I would have this phrase where it's like nobody really cares about the decision until it's been made.
Right.
And they're like, wait a minute, why would you do? And it's like we need to hear both sides. We need to hear all the sides, even if it's like I know I'm probably saying exactly what everybody's saying. Well, it helps to kind of know. Okay, this is the vibe that everybody has. I mean, I obviously try to check in with my core, people in Ward 4 that tend to reach out or tend to, have the opinion, and I'll reach out to kind of say, hey, can you take a look at this? Or I'm kind of on the fence on this one. But yeah, if there's anything that ever you talk to anybody where it's kind of like, how would this affect that guy that I've seen down the street from me or that family that I saw? How would this affect them? And either asking them directly if you see them or just kind of giving that perspective. And if you see something, say something, like send it my way if there's something that I'm even missing. I feel like for the most part, we try to cover everything and we're voting, on behalf of the constituents. I don't think any of us have like some personal agenda, like, well, I'm going to vote the way I want things, but You know, I mean, we try to weigh in everybody's input, but I definitely welcome you guys to send me anything especially once that contract comes out. Since we're just picking it apart, we haven't even seen it, but.
I know.
No, but I'm
really regretting
glad
not
to
asking
hear.
for a copy
No,
of that.
it's and I'm glad to hear that, I mean, it is. It's that tough little conundrum where it's kind of like, she did say there are people that don't, because I thought, is anyone turned away? Because I will tell you, if someone's actively, participating in criminal activity, I don't want to say, here's a room for you, because you're choosing that when they know that they could get shelter. They're aware that shelter's there and available, because it's just a different thing. That it's like, how far are we going to take this? For that intervention. But if she did say there were certain people that are not allowed back, which made me feel a little bit better, because it's kind of like if you're going to abuse the help shelters the same way. Like, you can't come in here if you're in the middle of, if they're going through like a mental, breakdown or whatever it may be, or psychosis. Like, they're not allowed to come into the shelter. They have to go to a hospital. And officers can't bring them to a shelter. They have to go to the hospital. So there is that. And I don't know if that's in place in the contract, So yeah, I just think all those things have to be taken into place. And she does have people that have been turned away because of behaviors at American Inn. Like, when they're sheltered, there's been enough complaints that they're no longer able to utilize this program. So.
Are we able to get grants so we could make it a full-time shelter and not just a emergency shelter? So the funding's there all the time and she can continue doing what she's doing now?
That would be great. She does apply for grants for sort of the other assistance she provides, with like a lot of food drives and things like that. But I would love if this, because it seems to be really taking off and popular, especially if we're going to be funding to where we're at 60,000. I don't know that we reached that last year.
Pretty close.
Pretty close.
Yeah, I
Was it
think
pretty
so,
close?
yeah.
I guess including the summer,
Yeah.
because we just let her keep the money. We're like, well, don't return it, and then we have hot days, and you're coming back, and yeah. And she was good about that. She just said, hey, I'm here to return the money that I didn't use, but I could use it. Like, it's gonna get hot, and I could use it. So that was good. And I couldn't remember what our final number was.
Yeah, I don't think it was at 60, but I don't think it was that far off.
Just shy or something,
Yeah.
within the ballpark. Okay, yeah. But see, I mean, we're not even halfway through January. We've still got February, which is always pretty cool too. So yeah, no, I absolutely think so, because I think this was put in place as like a quick idea. Hey, can we fund it? Yes, we believe we don't want anyone to die here. But now it's kind of reaching the point where it's like, if we go what's our cutoff, right? It's kind of like, okay, are we at 100? Are we at 200? Like, where's the cutoff, and how do we start to look at like, okay, what are our other resources that we can utilize? But I mean, she does a great thing to be able to find these people, and I'm glad they find her, and that she'll go out at like 2 a.m. and meet these people wherever they are, to kind of go, let's get this squared away. So I commend her for that. But yeah.
I will say too that the jail situation, the renovation's almost done at the county, so we're looking at 2-3 more months maybe of that. So I think that situation should subside. I could get started on the justice system, but that's for a topic for another. Okay.
Moving on to announcements. Sure. So, Snake Saturday Parade.
Yeah, I looked at the website, and it doesn't look like there's a registration deadline. It's $50 to it would be $50. I kind of want to gauge like who's interested in this and being in the parade. Okay. Okay.
Do we have a float already all backstage?
We don't. but we've got friends that have build things in municipal services. So
I think
we can
three
get
of
that
us
done.
are wearing is this flannel, so we're qualified to build things.
Wait, is that how that works?
Yeah.
Oh, okay.
I'm thinking
Um,
that the high school too.
Yeah,
they wanted
they
to
had
be
mentioned,
participate
yeah.
and help build the float.
So I say that if we're gonna do this and we've committed, this is also knowing that it's typically cold. So just want to put that out there. Yeah. Then we'll get started on really doing it. And at the next meeting, I would probably need a motion to expend some money on a float, potentially. One part. I don't even know what that would be, so let's just wait. Because I could on the float, yeah. Oh, it's $50. I'm sure I'll include that for next month, but I can just go ahead and do it. So yeah, and then let's engage with the high school. You have their contact information, right? Okay. Okay, that would be great. And just see like, hey, would you be interested in walking with us in the parade and yeah. Yeah.
When we were at the multicultural night, I don't know who it was. I don't know her name, but she kind of approached us and was like, yeah, we would definitely.
Okay. I know they
Do
seemed
that, so.
pretty into it when they were here. So, okay. Yeah. Okay. And then just a heads up that Pride Parade this year is June 8th of 2024. Last year I thought it was awesome. We walked in it. And so it was fun, wasn't it, Martin?
Yes.
Maybe if we register earlier, we'll be
Yeah.
further up in the parade. Yeah. Yeah. So, yeah, I think just as a city, we plan to do that again. And we had good staff turnout and everything last year. So, yeah.
It is also the same day as the Art in the
Arts
Park.
in the Park. I know. It's always been. So we thought about we would bring the float up to Arts in the Park afterwards and park it at Arts in the Park. Yeah. Yeah. And then we might serve beer that night so you can come see us again. So, yeah. Oh, girl, last year. It was a long day. Yeah, you worked the earlier shift. We worked the closing shift. Yeah.
I was just curious how the Multicultural Fest went. I wasn't able to make it, but did it go well for those of you who went?
Probably about twice as many people as there were.
They said that they had printed 300 of those passports that they gave everybody and that they ran out like within the first hour and a half. So
It was really neat. Yeah.
I was stuck at a council meeting. Yeah. Yeah. I'm like, I can't wait to not be there.
I know Mallory sent me an application for reappointment, so I'm gonna reapply, just as an announcement. I didn't know if anyone else was up. Or
Martin is, and he's already filled out his application.
good job.
And your reappointment will appear on the agenda on Tuesday.
Fantastic.
You're the mayor's at-large appointment. Yeah, and then I spoke with Jesse, and he would love to reappoint you, Daniel. So as soon as you get me that application, and then I don't think anyone else is up for a while, so we're good.
That's good. Yeah, we need
Yeah,
stability. So that's why I was asking. Good.
yeah,
Stabilizing.
Awesome.
yeah. We will have to wait and see because Bess's husband is running for council.
Okay.
And last time we let her stay on.
For the
But-
conflict of interest, huh?
Yeah,
Oh, interesting.
yeah.
So I couldn't appoint my brother to fill this seat.
You absolutely cannot. That is a direct violation of Missouri ethics laws, and they will come at you for that one.
Cool.
Yes.
She needed a reason to not.
She was looking for me to say that. She
Well, I
actually called me
can't.
before
No.
this. Yeah.
No, but she
No.
could come speak as just a resident. She's
Absolutely.
a
She could come
therapist.
speak. Yes. But the Missouri nepotism chart that the Missouri Ethics Commission uses is huge. It's like second cousin twice removed. You cannot appoint. Yeah. So
I ain't got no kin here.
There's no
it's
kid.
just very weird. I don't know. Must have been a lot of issues with family. Seems like it fits.
All right, does anyone move to adjourn this evening's meeting?
I'll move to adjourn.
All right, anyone second that?
I'll second that.
All right, in that case, we will adjourn here at about 8:14. We'll see you next time. Oh, I don't know.